Jensen. I'm a family practice physician located in Iowa, and I'm glad that you're here with me today. We're waiting for people to join in. For those of you who do not know me, I do these live streams every Saturday at 9 a.m. Central, every Sunday at 10 a.m. Central. And I encourage you to bring your questions to me and to ask those questions and hopefully get them answered. Now, I don't know every answer, but I will do my best. And if I don't know the answer, I will definitely let you know. Today, I have a special topic, and it because the clients that I get and the reason they hire me is because they want me to review their labs. And that is what I do. I think that there is a systemic panic in regards to lipid panels. I think that there is fear, and a lot of it is spurred on by cognitive dissonance. But this is where it takes a deep breath and to relax, and we need to go over things that a single lipid panel has many variables, you guys. It isn't a one size fits all. Your LDL's high, here's your medication. It's not like that. Now, am I a cardiologist? No. Do I need to be? No. I think that we have a specialization myth that only certain specialties, like a cardiologist, is privy to the truth. I don't believe that. I think that anyone willing to study something can master it. Do you need to go to a special mechanic school to learn how to fix your own engine or somebody else's engine? No. That is what we have been dealt with for years, and I think it's a myth that only a cardiologist can tell you how to read your lipid panel. The motivation, you guys, you would be so surprised. The motivation for cardiologists to do certain things is maybe beyond the scope of this particular live stream, but I think it's something that we need to talk about. We are going to maybe touch on the illusion of angiograms and the results. We're going to touch on collateral blood flow. We're going to talk on plaque location, the glycocalyx, CTEP, which is CETP. I call it CTEP. We're going to talk about your lipid panels, and it looks like Jim Rat has a question. Does an elevated LDL level in a 52-year-old man who is very healthy the same as the 52-year-old man who's very unhealthy? I don't know, Jim Rat. That is a very good question, and it brings up many variables that I want to expand on today. But you could be the healthy Jim Rat 52-year-old who has high LDL. But we would need to look at more things. We need to look at the size of those LDLs. And we need to look at inflammation. We need to look at a thyroid. We need to look at your diet, your exercise routine, your sleep patterns, your stress levels, whether or not you're getting out in the sun or you're under blue light all day long. We need to look at if you're a smoker, a drinker. We need to look at if you're under a lot of stress, have sickle cell disease. Jim Rat, I know that you want me to say, no, absolutely, a healthy 52-year-old with high LDL is healthier than a 52-year-old who's sedentary. I know you would like me to say that, but I can't, because you could have an athlete have cardiovascular disease and a sedentary bonbon couch potato is not going to. Okay. Jim Rat, we probably should go over some things. Jim Rat says, I just want the truth, because I don't believe most doctors, including my own, to correctly read the blood work. And that's where I come into the picture. Thank you, Penny. I appreciate the gift. You guys, if you are live on YouTube right now, please hit the thumbs up. Let's try to get up to 15 right now. If we can get to 15 thumbs up, I would appreciate it. Thank you for those listening. If you have a question, please put a question mark or a QQQ in front of your question so I know that I can see it. Also, the super chats and the super stickers, they do help with keeping this channel going. Lucy has joined us. Thank you, Lucy, for being here. She's my blue shield, my blue wrencher. And I appreciate her being here as long as she can today. So I appreciate that, even though she's got some things going on and she's spending her time. And I'm very thankful for her time to help monitor the YouTube. So back to Jim Rat's question. If I saw 52-year-old LDL that is high, what are my next steps? I need to get a full lab panel, and I mean extensive lab panel. I want to know the full thyroid panel. I want to know a clot factor panel. I want to know a full iron panel. I want to get an NMR. What is an NMR? It's short for nuclear magnetic resonance imaging. I want to basically know, what is your particle size? Can you do a cardio IQ test? Yes. Anytime whatever test it is, I need to know, what is your particle size? It gives me a lot of information, okay? I want to know an insulin level. I need to know, how is your liver functioning? I need a liver function panel. There is so much to go over. And I'm not trying to scare you, or I'm not trying to say, what am I trying to say? The more information I have, the better I am able to tell you what your risk factors could be. It's not a calculator. It's going over everything. I write out a detailed report to help you understand what is going on. Now, many of you who have consulted with me, I think you will vouch that the reports that I send to you are extensive and well written. If you do want to sign up for a consultation, I appreciate that, Lucy. Email me at ironladydoc@aol.com. IRON, Iron Lady, LADY, doc, at AOL.com. This is what I do now. I used to be the doctor in the doctor's office seeing patients one after the other, after the other, after the other, okay? I closed my practice a little over a year ago. My nurse retired, and I thought this is the most opportune time to shift gears and be able to help 3,000 people listening to me versus 10 a day. I'm seeing more patients now, more clients now, helping them decipher their blood work. And I'm learning with you guys. Every single day we discuss the case together, and we give all kinds of variables and all kinds of options. Is the option only medication? Absolutely not. But we need to know the diagnosis first, you guys. I don't just say, take this medication without really knowing your diagnosis. I need to know that NMR. I'd like to know a cholesterol balance test, Jim Rat. Are you an overproducer? Are you a hyper absorber? Do you have FH? Is it heterozygous or homozygous? I can tell a lot with lab tests. Jim Rat says, I agree with you 100%. The problem is my healthcare provider, Kaiser, limits what they test in blood work. They don't even test for testosterone levels in men unless there is a real health concern to do so. I get it, Jim Rat, and it's not just in California or wherever you're located that has Kaiser. It's everybody. It's in Iowa. Doctors will not order things a lot of times because it comes out of their pool of money. If they keep expenses low, they get more at the end of the year in their pool. It's a reality. Gym rat, sometimes we have to spend our own money and get our own lab tests. One of my highest clientele rate is from California. I don't know if that's where you're from, but I see a high amount of you guys from California as my clients. Most of you, if not all of you, get your own labs. You pay for them out of your own pocket. And I don't see very many people in Iowa do that. We are the insurance capital of the world. Okay, I'm over exaggerating, but people in Iowa think that if my insurance isn't going to pay for it, I'm not spending my own money. Great, but those aren't the clients that need my help. Okay, they're perfectly, they are content staying with their doctor and staying on standard of care measures. You got high LDL, here's your medication. And that's fine, but those aren't my clients. Okay? Yeah, thank you, Lucy. Please hit the thumbs up. Our goal was 15. We have 11 right now. Can you hit that thumbs up and let's get us up to, let's just say 20 now. Let's get it up to 20. Since we're at 11, let's expand. Let's get that thumbs up to 20. Jim Rat says, yes, I am in California. Sebastian, I missed a question here. Do any of the GLP products affect your LDL? Sure, they do affect your LDL. Can they raise LDL? It's possible. Can they decrease the amount of LDL receptors on the hepatocytes in the liver? Yep, that's all possible. Okay. Lucy says, my last set of complete labs was $900 out of pocket. My Kaiser won't get them. So Lucy is speaking from a insured Kaiser, and she said that Kaiser would not, approve any of her labs. She had to get those labs on her own. Our iShift says, have you tried Shilajit? I have. Sebastian says, what is this about? This is a health show, a health podcast. So if you're in the wrong place, you can absolutely just exit out and you won't have any problems. Okay. Do we have any questions over here on Instagram? You guys are real quiet. Make sure I didn't miss anything. We are live on Instagram and YouTube. So you Instagrammers, if you could hit the thumbs up or the likes, or can't remember it, maybe it's the heart button, and we'll get on the map over here. All right. Sebastian says, do you recommend vitamin supplements? Only if needed. If you are considering a vitamin, then I think that we need to check your levels and make sure that you actually need them. Okay. Brass says, all signs point to Ehlers-Danlos with my 24-year-old daughter. Where do we begin? She's uninsured. Well, you need to maybe get her on state insurance. That might be, where you start, okay? And then seeing a specialist would be in her best interest. Okay. Looking through and making sure I don't have any missed questions. If not, I will start with a little bit. Yeah, Johnny, I agree. We are in a sick care model in the United States. I don't know how other countries work, but yes, I believe that the United States has a sick care model rather than a prevention model. And that's, it is what it is, and that's why we need to educate ourselves. Arizona Nana says, I went through Superpower to get my labs, over 100 biomarkers. Can you use these for a consult? Absolutely. I can use any of the labs that you give me. I don't require you to get a special lab service, but if you have, Superpower, labs that you want me to review with you, I would be happy to. I will, if I go through and analyze your labs, I will likely suggest that you need more labs, and you can get those on your own or not. It's up to you. But usually I find that if I had some extra labs, I can make better, I have more information to work with to give you recommendations. So today, I want to talk about maybe what Jim Rat brought up in regards to a 52-year-old gym rat versus a 52-year-old couch potato. And there are two different ways of looking at this, and they're not the only two ways, but we could look at it from a diet perspective. Is the person who's the couch potato the high carb, high saturated fat, or high carb, high polyunsaturated fat person? Or like Jim Rat are you a low carb, high saturated fat, otherwise known as, in some schools of thought, a lean mass hyperresponder? Looking at lipids is very controversial, but I believe going through the cholesterol panels and advanced lipid tests, I can give you a better idea of what's going on. If we have a particle size test, we will know whether your particles of LDL are light and fluffy or small and dense. For the most part, small, dense LDLs result from high carb diets. High carb diets lead to small, dense LDLs. Why? When we consume high carbs, carbs in excess for you, I'm not going to give a number of high carbs because your high carb might be 20. Someone else's high carb might be 100. So from my perspective, if you are eating carbohydrates and your liver is packaging up all of those triglycerides into VLDLs, that liver is sending those VLDLs out into the bloodstream. Patrice, thank you so much for that super chat. And I'll get to this question in a second, okay? Patrice says, I highly recommend consulting with Dr. Jensen for labs for peace of mind regarding your own health status. Get a consult. Medicare wouldn't even pay for a cholesterol screening. Don't wait. So, Patrice, thank you for that. If you are the person eating a high carb diet, your liver has to process those carbohydrates. It does so by packaging up that energy, that fuel, in the form of triglycerides and packaging them up into something called a VLDL, very low dense LDL. That VLDL is sent out into the bloodstream and it will deliver the energy to the areas that need it, like muscles. So the VLDL is packaged full of triglycerides. Those triglycerides are an energy source. They're an energy source for muscles and cells. And if your cells and muscles are there and they're hungry, they are going to take up those triglycerides for energy. If the areas that, like these cells and the muscles have no need for more energy, they're full, they are full, they don't want any more food, those VLDLs will remain in your bloodstream full of triglycerides. They can't dump off the triglycerides because there's no area, like muscles, to take up those triglycerides. They don't need any more energy. So that VLDL stays in the bloodstream and it bumps up against the LDLs in the bloodstream. A normal sequence is for a VLDL to dump off its triglycerides to cells that need it for energy. That is a normal progression. When a VLDL dumps off its triglycerides, it becomes an IDL, intermediate density lipoprotein. If it dumps off more, it becomes an LDL, low density lipoprotein. If you have so much energy coming in via our mouth, and the liver keeps packaging up LDLs and dumping the VLDLs into the bloodstream, those VLDLs can collide with LDLs in the bloodstream. The VLDLs are high in number, the LDLs are high in number, and they bang up against each other. And then a reaction occurs. If you have a lot of VLDLs, those VLDLs bump into LDLs and they exchange components. The VLDL will want to get rid of its triglycerides, and they dump those triglycerides into an LDL. This damages the LDL. The LDL is not supposed to have triglycerides in it, only the VLDL. If this collision occurs, a reaction occurs and a transfer occurs via something called CETP, CETP. In order for CETP to aggressively transform a large LDL into a small dense LDL, it requires high circulating VLDL to stay in the bloodstream for long periods of time. The liver packages up the VLDL, and because it can't dump its triglycerides energy into other cells because they're full, the VLDL stays in the circulation a long time. It has a chance to bump up against an LDL. They exchange components, and now the LDL is carrying triglycerides, and it dumped its cholesterol back into the VLDL. Now the LDL is naked, full of triglycerides that can get oxidized. It can now shrivel up and become a small, dense LDL. And those small, dense LDLs are stickier, they're smaller, and they're oxidized, they're damaged. And they can take part in all kinds of nasty scenarios, one of which is helping to promote plaque formation in an artery. Now, many of you think that the artery is being clogged from the inside out, or just from the inside. And I need you to understand that when circulating LDL and small dense LDLs and IDLs and VLDLs are in the bloodstream, they don't form a blockage on the lumen, the innermost aspect of the artery, okay? The small dense LDLs can enter the innermost lining, which is the glycocalyx, because there is an injury. The glycocalyx is there for a reason. It's the innermost slippery gel-like layer full of proteoglycans and sugar type molecules, glycoproteins that protect the artery lining inside from getting damaged. So if the glycocalyx is intact, nothing can narrow the inner lumen. How a lumen, the innermost aspect, gets narrowed is because things can go through the glycocalyx when the glycocalyx is injured. How does the glycocalyx get injured? High sugar, alcohol, smoking, sickle cell disease, iron overload, high blood pressure, high volume, force and volume can injure the glycocalyx. As long as we keep the glycocalyx healthy, then things can't penetrate, like the small dense LDLs penetrate and get through the glycocalyx. If they get through the glycocalyx, the next layer is the endothelial layer, and it's only one cell layer thick. Can those endothelial cells take up small dense LDLs? Yes. Do they go between the cells? Likely not. Likely not. They're too big. Small dense LDLs are even smaller and they have a better chance. So the plaque formation is not forming in the middle of the tube. It's forming inside the glycocalyx, inside the endothelium, to the muscle, the intima. Okay? So when that plaque is forming in the intima, it pushes the lumen closed. And that plaque, you guys, needs a blood flow. The plaque needs blood flow. It needs nutrients. A plaque cannot live on its own. Once it's formed, it can't just live. It is living tissue and it needs blood flow and nutrients. So how does the plaque that's not in the lumen, it's inside the wall of the artery, how does it get blood flow? I'm glad you asked. It survives for blood flow because of something called a vasovasorum. Large arteries need a blood source. So on the outside aspect of every big artery are tiny little arteries called a vasovasorum. And when they sense that something needs blood, like your soft plaque, they start neovascularization. They build new blood vessels. Tiny little blood vessels creep through the outer aspect of the artery, the big artery, and feed the little plaque. Now, the bad thing about these tiny little arteries feeding the plaque, they are very fragile. They burst very easily. And when they burst, red blood cells and all kinds of things that they are carrying get into that plaque. That's why that plaque has so much debris in it. And those red blood cells deliver cholesterol because in a red blood cell membrane is cholesterol. It doesn't need an LDL particle to deliver. It's its own particle delivering cholesterol to that plaque, trying to heal it, right? That's what cholesterol does. It's healing. It's our immune system. But when it gets over damaged and more plaque is forming, there needs to be more blood flow and more red blood cells. And eventually that plaque gets harder because it calcifies. And there's mechanisms. I could go deeper into why it calcifies, but over time, it calcifies. And that could be considered a good thing. It's not fragile anymore. It's more stable, but it's still growing. And if it grows, it can push the lumen closed. Now, it takes at least 70% of just simple lumen narrowing to block blood flow. Okay? But something else is going to happen before that, likely. Okay? It's going to happen before that lumen gets 70%. Something like the soft plaque is going, that core, the softness, can break off and cause a blood clot in your brain or your heart. And most heart attacks are not simply because of, they had blocked blood flow, as much as they had a clotting event. Okay? A clot event. And that blocked off the lumen. Not hard plaque begetting hard plaque begetting hard plaque. That takes forever. Now, if you have hard plaque on a calcium score, you know that you at one time had soft plaque or still have soft plaque. If your calcium score goes up every 3 or 4 years, you know that you still have soft plaque hardening, unless, of course, you have on board a statin, which will calcify in excess. It'll just keep calcifying everything. Okay? So this is complicated stuff, and it isn't just, I got LDLs and I need to lower them. Now, back to Jim Rat's question. The LDLs are different. They are different. Okay? No, that's not why statins are bad. That statins, the two most important things about statins, if you gave, what are the two most things that, that statins, if there's going to be something positive about them, they are anti-inflammatory. They're like Advil for your arteries. And they have a component of anti-thrombotic activity. They're going to block thrombus clot formation. Those are the two most positive things. Do they alter the cap? Yes. They will continue to harden the cap on a soft plaque. So I guess there's 3 things that a statin can do, and those sound like amazing things. Can you do any of that on your own? I believe yes. The fact that statins work by blocking HMG-CoA reductase, blocking the mevalonate pathway, is where I start having problems, because you're actually blocking cholesterol production. You're blocking everything from the liver, which has HMG-CoA reductase, everything downstream to block cholesterol formation, as if we don't need cholesterol being formed in our body. I do not believe that. I believe we need cholesterol, and you guys believe that too. But if you have the paradigm that all LDL is bad, and we don't need LDL, and you don't need that much cholesterol for your brain or your myelin sheath or your cell membranes, then you will hold fast to the lipid hypothesis of coronary artery disease. I used to hold fast to that. I used to think the LDL, if you lower it, the better, and you're not going to have a heart attack. When in fact, my patients were still having heart attacks even though their LDLs was below 70. It goes back to, why are those LDLs bad? What initially caused it? And for the most part, a majority of people start out having injury to their lining of their arteries because of insulin resistance, because of a crapola diet. They eat diets that are very high in carbs and processed refined sugars and seed oils, and it injures the lining of the artery. They're very inflammatory. Insulin that's being produced is very inflammatory. We get the liver starting to produce a bunch of VLDLs to package up all of the crap that you're taking in that you do not need. It has no nutritional value. It just tastes good because you're addicted to big food. And they've got you. They've got your dopamine receptors. They didn't even have to try very hard. They just put it in front of you. You took one bite and it was like crack cocaine to you, okay? And your liver now has to get rid of that. And so it packages it up into VLDL and sends that VLDL out into the bloodstream, hoping that you have enough muscle to take up that energy. Now, can a low-carb dieter have problems with too much LDL? Yeah. If a carnivore is eating high amounts of saturated fat in the form of animal fats, the liver, well, let's just say the body relies on that fat for fuel. There's no carbs coming in, remember? And all they're consuming is protein and saturated fat. The body relies on that fat for fuel. It'll break down those fats and you will have ketones being produced. The liver now, when your body is full of these saturated fats, the liver is going to down-regulate LDL receptors on the liver cells. What does that mean for you? I'm glad you asked. A normal process of the liver packaging up VLDLs, sending them out into the bloodstream, becoming IDLs, then LDLs dumping off cholesterol where it's needed, and then the LDL comes back to the liver, knocks on the LDL receptor door, and the LDL receptor opens up and the LDL can come back in, either to be recycled or to be made into bile, and then we end up having a bowel movement and getting rid of that excess cholesterol, those particles, okay? The HDL will then pick up any remnant cholesterol that is in the cells and the membranes and bring that back as well. HDLs do that. They're the cleanup crew. If the liver downregulates the LDL receptors because the cells are saturated with energy, the liver rapidly packages those up to make ketones. So the VLDL in a lean mass hyperresponder is going to not stay in the bloodstream as long as the VLDL in a high carb crapola eating person. In that standard American diet person, the VLDLs are in the bloodstream for extreme amounts of time versus a lean mass hyperresponder who's packaging up a whole bunch of saturated fat, dumping it into the VLDLs into the bloodstream. That VLDL doesn't stay in the system very long. If it doesn't stay in the system very long, it has less chance of colliding with the LDLs and doing that whole process. Okay? Are there any questions? This is a lot. Give me questions. They're not, none of it is dumb, okay? Prime Colors asks a question. Would it be better for you to take or not take a statin if you're eating a poor diet? If you're eating a poor diet, we are going to assume that you have insulin resistance and that you have high triglycerides and low HDL. If we assume that, now is that always the case? No, you could eat a poor diet and be a big muscle-bound person, and your muscles, fortunately, are taking up all of the energy. Now, is the liver still capable of having insulin resistance? Absolutely. And say bodybuilders or muscle-bound people don't understand that. Even though systemically they are insulin sensitive, their liver is insulin resistant. That is another topic. But to get back to Prime Colors, would it be better to take a statin if you eat a standard American diet? I don't know. I would want to see your labs first. 2, is statin the best choice if our goal is to lower the triglycerides? So you're saying Prime Colors they're not going to change their diet. They're going to continue to eat a crapola diet. And they're asking, would you take a statin? Me, personally, I don't like the downstream effects. I'm going to take something that might be less harmful on my body. And I would probably take something that is antithrombotic and anti-inflammatory versus a statin. That's me. This is not medical advice. I'm a doctor, but not your doctor. There is no doctor-patient relationship being established right now. You asked my opinion, and I gave you my opinion on what I would do, and that would not be it. Okay? I'm going to, I'm going to change my diet. But a lot of people don't want to change their diet, and they would rather just play Russian roulette, take the medication, and hope for the best. And sometimes people get the best and some people do not get the best. Some people have a heart attack anyway. There's nothing magical about a statin preventing your heart attack because it lowers LDL. Nothing magical at all. Okay? Yeah, Jim Rat, it's hard for me. I know it's a lot of information. And I think breaking it down into normal steps on how our body deals with things and abnormal steps. And your case being a gym rat, it is different. If you're a healthy 52-year-old, but there's so many nuances, Jim Rat. There's so many nuances that your body is doing. And that's why one size fits all, giving everybody a statin when they may not need it. There are people who have very, very high LDL levels that live longer than the general population, okay? And some of those people even have heterozygous FH, familial hyperlipidemia, or hypercholesterolemia. But looking into everything, making sure your thyroid is pristine, your iron levels are pristine, your blood clot factors. What if, Jim Rat, what if all your LDLs are large and fluffy, yet you have blood clot factors that no one looked into? What if you have factor 8, factor 5, prothrombin mutation? What if your fibrinogen levels are elevated? All of those things could lead to a blood clot, and they have nothing to do with your LDL. Okay? We need to look. Okay. A question. Hold on. A question by. Is it Alan? Let's say. Alina. I think it's Alina. Alina says, would drinking water with lemon and ginger help with high cholesterol? I do not know. I don't know. Is your cholesterol being high? Is it a problem? Who says it's high? What are the factors of high cholesterol? Why is it high? I mean, again, this is all everything that we've been thrown at. It's cholesterol is high if it's over 200. Okay? How do you even measure cholesterol? You cannot just measure cholesterol in your bloodstream. That is a calculated piece of information. Cholesterol is fat soluble. Blood is water soluble. You can't just measure cholesterol in your bloodstream. It has to be measured inside a particle that's carrying it, like an LDL. That's why we get LDL cholesterol. The LDL, the particle, lipoprotein, is what carries cholesterol, okay? So I don't know who told you your LDL was high. I don't know what constitutes a high LDL, but I would want to know your breakdown. If your triglycerides are over 70 and your HDL is under 70, you have a problem. Now, does lemon and ginger help with that? I'm not sure. Pisces says some carnivores need to reduce saturated fats, like me. I've done that and feel great, says Dina. Okay, now let's talk about this. Why does Dina need to lower her saturated fat? Because some people who eat tremendous amounts of saturated fat, I'm just saying a ribeye a couple times a day, and some butter, and some eggs, and whatever carnivores eat, they are getting, for their body, too much saturated fat. What does saturated fat do in some people? It down-regulates LDL receptors. If your liver cells have only 50 LDL receptors and it needs 300, that means 250 LDL stay in the bloodstream longer instead of getting taken up by the liver. So saturated fat notoriously lowers LDL receptors on the liver. So does menopause, so does low thyroid. There's many things that can lower LDL receptors on the liver cells. If you are that person and you eating saturated fat causes complete downregulation of LDL receptors, your blood will be sky high in LDLs. Now I need to know, are those LDLs being bumped into by VLDL? How do I know? I'm going to get your small, dense LDL level. If you have a lot of small, dense LDLs, I know that you need to decrease the amount of saturated fat in your diet. I know you might not want to hear that, you carnivores out there, but you must. It doesn't mean you need to take in plant foods. I'm not saying that. You can still be a carnivore and lower saturated fat. You pick leaner choices. Instead of a ribeye, you pick a filet. Instead of 80-20 ground beef, you pick 97. Instead of a stick of butter, you go to a half a stick of butter a day. And when you lower that fat, you increase monounsaturated fat. Why do I say that? Because monounsaturated fats upregulate LDL receptors. What are great carnivore sources of monounsaturated fat? Emu fat, emu, you know what an emu is? It's an animal. Their fat, very high in monounsaturated fat and vitamin K. What about lard? 50-50, almost monounsaturated to saturated fat. What about duck fat? Same thing. So you could stick to a carnivore diet and still increase monounsaturated fat. You could add in macadamia nuts if you wanted to. You can add in avocado if you wanted to. But if you completely want to stay away from plants and you're purely carnivore, then choose emu or duck or lard. And that will increase monounsaturated fat. So if you were eating 100 grams of saturated fat, now you're going to back it down to 50 and increase monounsaturated fat back up to 50. Okay? And then you will recheck your labs. Maybe you're going to find that you need to even go lower. 25% is saturated and 75% is monounsaturated. I don't know that until we continue to check your labs and see how your body is responding. You might need to eat some more chicken and less beef. Chicken has less saturated fat. What about fish? Exactly. So are you still a carnivore? Yeah. Are you eating as much ruminant meats? No. Deer is going to be less fattier than a cow. Bison, buffalo, less fattier. Those are options. Again, a lot of variables. So if we recheck Dina's labs in 3 months and she lowered her saturated fat, increased her monounsaturated fat, we should see her LDL plummet and her LDL receptors go up. Also, we got to fix the thyroid. We got to make sure there's no clotting factors because maybe Dina needs to take something like nattokinase or lumbrokinase. Something like that to make sure we keep fibrin levels low. That builds up clots. Now, doesn't our body break down clots? It should, but when you overwhelm it, the fibrinolytic pathway can't keep up. So there's a balance. But a lot of people, a lot of doctors, they can't spend that much time with you. I'm not sure they even know all of this. Why? I didn't know all of this. Had I not been a master learner, I would have never got this if I went into an internal medicine residency and I studied to be a cardiology fellow, okay? I don't know if I would have gotten all of this because our training is such a tunnel vision, you guys. LDL's high, here's your statin. You got depression, here's your antidepressant. You got blood pressure, antihypertensive. That's what we're taught. And then if I was an interventional cardiologist, I get paid to do procedures. If I don't do enough procedure, guess what? I lose my certification. What are you talking? What? Yeah, that is possible. Say I'm an interventional cardiologist and I put stents in all day long. And I decide, oh my gosh, I read the, what is the, I think I wrote it down. Maybe I wrote it down. Maybe I did not write it down. Shoot, maybe I didn't write it down. There is, I did write it down. The Stanford-led ischemia trial. or the Orbita trials show that sometimes putting a stent or doing a bypass do not reduce the risk of heart attack or death. So you go in, they do an angiogram, they see you got blocked arteries, which, by the way, if you have the athlete's paradox and you're an endurance athlete, do not let them do stuff on you right away. If they tell you that your arteries are completely blocked, do further testing, okay? If you're that endurance athlete. If you're just a general person off the street doing the couch potato thing, occasionally working out, doing that, and they say your arteries are blocked and we need to put a stent in, maybe take that advice. But according to the ischemia trial for the athlete's paradox and the Orbita trial, there has been very little evidence that say doing a stent or a cabbage on these athletes prevents heart attacks or strokes or death, heart attacks or death. How about that? The Stanford-led ischemia trial and the Orbita trial. Just read them if you are that athlete paradox person. Okay. Pisces, Dina, thank you for bringing that up. This is very, very good. Very good questions. Very good questions, and it spurs me to unravel everything that's in my head. Mamiata. So is the Atkins diet that puts you in ketosis good for you? I was on the Atkins diet back in the 80s. I don't know what is in the Atkins diet. I'm guessing it is high fat, high protein. You got to come over here if you want to come up. Come up. Can you come up this way? Come on, jump. Okay, jump. You can do it. No, he won't let me pick him up. It's Buddy Blue. Buddy Blue says, I think I want to come up and sit on your lap, but I'm not going to come up there. I can't. Do you want me to pick you up? He's so oblong. Okay, we got Buddy Blue. All right, you got to be. Okay, we're talking to the people now. We're talking to the people, see? Okay, all right. So I believe the Atkins diet is high fat and low protein. I think it's high fat and low protein. If you get into ketosis, our heart, our brain, our organs would rather have ketones than glucose. I know you can't believe that, but it's true. And if you have any type of heart disease, a ketosis diet, a ketogenic diet, actually helps increase stroke volume and cardiac output. So yeah, your heart would be better off on a ketogenic diet. But again, the caveat is if your cells, let's just say you're a skinny little person, you have no muscle, and you are overeating saturated fats, your body can't keep up. It's going to have those VLDLs bumping into the LDLs and forming small dense LDLs. And those small dense LDLs, yes, are higher risk of penetrating, sticking to an injury if there is one. Let's say you go on a binge smoking and drinking for the weekend with your gal friends or guy friends, and you get an injury and you had some sticky small dense LDLs and you have blood clot factors, you formed a blood clot, it broke off, and yeah, you had a heart attack. And when they check your LDL, it was perfectly normal. There's so many possibilities, and just taking a medication isn't, taking a statin or a PCSK9 or even a CTEP inhibitor, which they tried to do in the past. So there's these medications called the CTEP inhibitor. Remember, when you have a VLDL and an LDL, the reason they can exchange parts is via a transfer protein called CTEP, CETP. And so what they are doing is making medicines that actually block that transfer. So you can have a whole bunch of VLDLs that even if they collided to the LDLs, they can't exchange parts to make the LDL into a small dense LDL. I mean, imagine that. Now, eventually, something's going to occur, and maybe you need a combination. You're going to need a PCSK9 inhibitor, and you're going to need a CTEP and probably your statin, because we just want to stop the production of all cholesterol. This is how big pharma gets way out of hand, okay? Oh, this is good stuff, you guys. Arizona, oh. Pisces says, when does gluconeogenesis come into play? Why and how does the body convert protein to glucose? It always does. Remember, we need 5 grams of glucose in our bloodstream at any one time. But say you're a stressed out, hypervigilant, fixer, people-pleasing guru, and you are stressed. You have high cortisol or high epinephrine, norepinephrine. You have high fight or flight, chronic fight or flight. Your liver, especially at night, you guys, especially at night, your liver is making glucose all the time, even when it doesn't really need to, but it senses it because of other hormones in your body, other things going on. And so a person who's a carnivore could still have extreme amounts of gluconeogenesis going on because of high cortisol, a fight or flight reaction that's occurring. And then that liver is going to package up that glucose in the form of triglycerides, dump it into the bloodstream, and then we go through the whole 9 yards again. So what does a person do who is this fight or flight? They need to work on lowering sympathetic chronic fight or flight activity in their body and increase parasympathetic tone. Parasympathetic is calming. Sympathetic is activating or stimulating. We have enough stimulation during the day. We do coffee, we have exercise, we got stress at work and all kinds of stuff going on. We do not need that at night when we're trying to sleep. We want everything to relax, parasympathetic at nighttime. I think I missed a question over here. Okay, Retail My Ride. I've recently rebalanced my protein to saturated fat by going with leaner cuts while remaining carnivore. Excellent, excellent. So Retail My Ride is lowering the amount of saturated fats and maybe increasing some monounsaturated fat. And overall, that will help increase the amount of LDL receptors on the liver so we can snatch those LDLs out of the blood so they don't have a chance to get collided with the VLDLs. Now, remember, I told you that initially when people go on carnivore diets, they could lose weight and they can lose fat weight. When fat is breaking down, it busts open and secretes or leaks out triglycerides and cholesterol. So I do not recommend anybody initially when they go on a weight loss diet of any kind to recheck their labs, because it's going to look like the triglycerides skyrocketed and LDL for that matter could skyrocket. Don't check your labs. Go 3 or 4 months after your weight has stabilized. After your weight is stable, if you continuously are losing weight, let's say you had 300 pounds and you need to get down to 150, you could be losing weight over a year's time. That's not really a time to be going after labs because they're going to be skewed. You're still breaking down fat, losing fat, and those fat cells are shriveling up and leaking their contents. Triglycerides could look high, LDL could look high, and your thyroid can actually kind of shut down a bit. If your thyroid shuts down a bit because you're going into this weight loss, then LDL receptors can downregulate, meaning there's less LDL receptors to take up all the other stuff. It's not because of maybe what you're eating, it's because the thyroid is kind of going into hibernation a little bit because it sees you losing weight, and that's kind of stressful. It feels good, but it's a little stressful for your body, for your thyroid. It wants to protect you. Lisa, says keto for 2.5 months. Blood work shows skyrocketing lipid levels. Okay? Keto, 2.5 months. Probably was losing some weight. Probably was shrinking up fat cells. Triglycerides went up. LDL goes up. Blood work shows skyrocketing except trigs and HDLs. So your triglycerides and your HDL stayed where? They didn't go up, but what were they? ApoA, is that LP little a is 120, or is that ApoA1? Remember, there is a difference. ApoA1 is measuring HDL. LP little a, lipoprotein A, is measuring LP little a. All right? Yeah. LDL is 260. HDL was 43. Trigs 60. So this lipid panel still puts you at risk metabolically. You don't just drop the keto. It's only been 2 months. Again, way too early. They're worried that your LDL is some magically going to cause you to have a heart attack. Impossible. The LDL doesn't cause the heart attack. Okay? We just went through this. We talked the difference between a narrowing lumen and a blood clot. LDLs don't cause that. Either one of those things. Your doctor has a condition of ignorosis. Osis means condition of ignorance in this case. Pisces says, could you discuss the ideal time condition to test labs? Because we always fasting labs, but then doesn't that push our body to release fats? Okay. The most opportune time to obtain labs is after a 10 to 12 hour fast. I would do lab draw around 10 a.m. That's when our cortisol is most stable. I would not exercise, including any sex, for 48 hours. That's exercise. No exercise for 48 hours prior to the lab draw. Drink water. Stay hydrated. Try not to be stressed driving over to the blood draw station. That could increase your fight or flight, which will increase cortisol, which will increase blood sugar, then insulin. So that is the most opportune time. 10 a.m., 10 to 12 hour fast, no exercise prior, 48 hours prior to blood draws, and be consistent. If you're consistent every time, then you have a comparison to go by. If you go longer, if you're going longer than 12 hours, your body senses that you are fasting and that you need cholesterol. So the liver is going to start packaging up more cholesterol. So your cholesterol, even your triglyceride levels could look high because the VLDL is what carries triglycerides. Okay, so your liver is going to start producing cholesterol and then packaging that up in a VLDL. So things can get skewed with long fasts greater than 13 hours before a blood draw. Okay? Tia says, I just joined. My apologies. Can you briefly repeat the lumen information? I'm going to let you re-listen to, because there's a lot of questions right now. I'm going to let you guys re-listen to the recording when it comes out later today or tomorrow. Yes, Dina, a lot of it has to do with cortisol, okay? Stress, the sympathetic nervous system. That is really the only way, one of the only ways that a truly carnivore person can still have elevated triglycerides and blood sugar, is because their body is in a chronic situation of fight or flight. Usually the person does not even know it. I'm not stressed out. I'm normal. Exactly. Your body is so used to chronic stress, your hypervigilance, you don't even notice it anymore. Your heart rate actually stays down and you don't feel stressed. But inside your body, you are constantly in overdrive. But you don't sense it externally because you're so used to it. That doesn't make it right, but a lot of times your labs will indicate that. Okay? Pasha says, so does this mean fasting is bad for someone with heart disease? I don't think I said that. Okay. What kind of heart disease? So we have to have some definitions. And I would need to look at labs. So signing up for a consultation might be in your best interest. I don't know if a heart disease person can tolerate fasting. I'm not sure. Okay. If they are a very obese person, if their BMI is over 30, they can likely tolerate fasting. They will break down their own fat to make fatty acids and ketones, and that is actually good for their heart. Now, again, if you're going from a standard American diet to fasting, they're going to go into withdrawal. That's a stress. That's sympathetic overdrive, and they could have an injury, a vascular injury, and have a heart attack. So you want to go you don't want to go cold turkey with somebody like that. But again, there's so many variables that I would need to see the whole picture. Tia says, I know my body is in sympathetic mode. It's depleting me. Absolutely. It's when we're in sympathetic overdrive, we have more reactive oxygen species, and we are using up all of our antioxidants in our body. Is that a reason to take antioxidants? No, don't hear me say that. We need to fix why you're in chronic overdrive, sympathetic overdrive, and we need to help that. Emotionally, physically, spiritually, we need to be on the same level, okay? And if we are emotionally, chronically elevated sympathetic nervous system, we could have a heart attack and our LDL could be in what they consider normal, under 100. Again, a lot of variables to look at. Yeah, Prasha, again, I maybe encourage him to schedule a consultation. We can go over things. Pisces says, Dr. J is a master evaluator of blood work. Get a consult if you have complicated questions you need answered, or even uncomplicated questions that you need answered. Some people have so much anxiety about their lipid panels, and honestly, that's what's going to cause a problem. Take a deep breath, relax. Nothing is going to happen to you in the next few moments. You don't need to, run to the emergency room or do anything or make a decision right this minute without thinking things through. Take a deep breath, get a second opinion, go over everything, and then have enough information that you can make an informed decision that best suits you. Okay? Do not jump into anything and let somebody freak you out. Okay? Pisces says, is the cortisol level the best marker for sympathetic overdrive? Yeah, it's a great marker, but it's variable. If here's how I look at it. If a person if they're eating carnivore and they still have elevated blood sugars beyond what you think, the blood sugars on a carnivore diet should really be in a fasting state between 70 and 80. And when they start creeping up around 100, you got to wonder if something else is going on. The blood sugar will be, say, 90. And you say, well, isn't that great? It's below 100. Yeah, but maybe not in a person who's not eating any carbs, okay? Maybe this person isn't sleeping. That's their only thing. They're only getting 4 hours of sleep. Can that be chronic sympathetic overdrive? Yeah. Do I need a cortisol level for that? No. I can look at other things and see that. I can look at your insulin level. It could be in the 3 to 5, but it's going to be on the upper limits. It could be 5, 6, 7. You say, it's not really that bad. Okay. Tia says, I have congestive heart failure, high BMI, although I lost 40 pounds after 3 heart surgeries, and I have always fasted, but for spiritual reasons. Okay. Thank you for sharing. All right. Let's see. Prime Colors says, my dad takes a statin and is insulin resistant, but he keeps eating ice cream and other junk and a lot of salt too. It's not the salt that's the problem. It's the junk that has fake salt in it, processed salt. But yeah, that Prime Colors, that's a problem. That statin's not going to save your dad's life. Okay. The most common cause of that inflammation is high blood sugar and high insulin. He's just making more soft plaque, and he's relying on his statin to cap it off, to calcify it, to stabilize it. Then it's just going to keep making more and more and more plaque. And that plaque from the inside to the lumen is going to push the lumen closer and closer together. And over a decade to time, yeah, they could have a 70% or greater narrowing, and it decreases blood flow. And they're starting to get angina, chest pain, and shortness of breath. Yeah. But you can tell the horse all the information, but and lead them to the water, but the person needs to want it. They got to want to stop the ice cream and the junk food. But you know what? Prime Colors, God is good, and your dad could live till he's 100 and continue to eat junk foods and never have a heart attack. Only God knows that. But the odds are stacked against him eating that type of food and taking a statin. That's, he developed a cough from taking the statin. Is that a common side effect? Not usually. Usually that is from a blood pressure medicine. So if he's on an ACE inhibitor, that is the usual cause of a cough, generally, from a medicine standpoint. And a lot of times doctors will treat any type of blood pressure, and the first thing that they treat them with is an ACE inhibitor. So lisinopril, Acupril, Quinapril, all the prils, anything that ends in pril is an ACE inhibitor, and those can notoriously cause a non-productive cough from bradykinin, a bradykinin cough. Nolan says to Prime Colors, if your dad stops eating sugar for about 2 weeks, he won't crave it anymore, from my experience and other family members. Good point. Nolan says, would you learn that from a gene test? Would I learn what from a gene test? Sorry, I can't go back or know what's going on. So if you could just make your questions in a complete, as if I've never read before. Prime Color says, yeah, I've done that before. It's crazy how bad sugar tastes after 2 weeks. Wild Dog says, autophagy is everything to proper wellness. Okay? Autophagy, for those of you who do not know, is cleanup crew. It's maid service. The only way that you can go into autophagy is if insulin is low and mTOR is low. You can't get into autophagy if insulin is high. If insulin is high, you cannot perform autophagy. You are growing, not breaking down. Insulin is anabolic. mTOR is anabolic. Insulin is high, mTOR is high, autophagy is low. Could you fast for 24 hours and have some autophagy? Yes. Even if insulin is high? Questionable. But usually if you fast for over 24 hours, insulin is going to drop no matter what. And then autophagy can go into place. Fasting is the fastest way to get into autophagy. Ketogenic diet is the next fastest way to get into autophagy. Neither one of those include carbs with high blood sugar and high insulin. See? High insulin, no autophagy. Okay. Prime Colors says, I stopped going to the doctor for anything other than broken bones and other emergencies. I hope you have no broken bones or emergencies. Okay, they know less than nothing about diet and exercise. That's why you guys are educating yourself. Isn't it amazing how much more information that your brain is taking in than any doctor around you? If you started talking to them about CTEP and bumping LDLs into VLDLs VLDLs bumping into LDLs and causing small dense LDLs, they're going to think that you're talking a foreign language. And they got 17 years of education under their belt, all indoctrinated from the university 4-year undergrad degree to the medical school to the 3, 4, 5, 6-year residency and fellowship programs. Yeah, all indoctrination. The curriculum is all written by the same people. It is. We have billion-dollar industries that train us as doctors to be their little pawns. Wild Dog says, I became anemic and now all of a sudden stable. I don't, okay. Help me out. I don't know if that was a question or not. I don't know how you became anemic and now it's stable. Mr. Doobie says, why as a carnivore my triglycerides are low? They should be low on a carnivore diet because you're not eating carbs. Carbs raise triglycerides. Carbs need to be processed by the liver. They package them up into VLDLs and send them out into the bloodstream. High VLDLs, high triglycerides, low HDL. That is not usually a carnivore, unless, of course, that carnivore is a stressed out carnivore, not sleeping and under a great deal of stress with a high chronic sympathetic overdrive. Mr. Doobie says 71 years old and carnivore for 7 years. Good. Hopefully you are healthy. Cholesterol is 146. What's your LDL, HDL, VLDL, triglycerides? What is all that? Wild Dog went from 370 pounds down to 170 pounds over 7 years. Wow. Okay. Hi, Vincent. Thank you for being here. Okay. Victoria says, doctor this week sounded like a used car salesman trying to get me on blood pressure and statins because my blood pressure was 130/80. And all the 9 shots I kindly declined. Doctor walked out of the room angry. I was shocked. It happens every day. You just traumatized their ego. You gave them a narcissistic injury. Victoria, well done. Although it won't change their thought process, but it helps you. Yes, it will be available to watch later, just like all of my other reels. They're on my grid. All of my reels and live streams are on the grid. So if you go to my, channel, Iron Lady Doc, you will see all of my grid of reels, 1,500 of them. And you can watch anyone. The ones that are the reels are labeled. The ones that have no labeling are the live streams. I did that on purpose. You'll see a Saturday, Sunday little grid on the grid, and it will have no labeling, no title. The reels, for the most part, unless I forgot before I shared it, will have a title of what I'm discussing in that particular reel. So hopefully that answers your question. Angela says, I've got fibromyalgia and lumbar slipped disc. Past 3 years, I've put on about 2 stone. I'm not sure what that is. Like, how many pounds is that? I'm 44-year-old female, had a hysterectomy, so your uterus is out. Are your ovaries out? Did you have a total hysterectomy with oophorectomy? or just the hysterectomy? Any advice on losing weight? I would give you the advice of avoiding any processed foods, seed oils, and glucose, sugar. Glucose, seed oils, and processed foods. You don't have to overeat if you're eating things that raise insulin. You could eat 3 cookies and still have high insulin, and you will never lose weight. If your insulin is high, you cannot lose fat. It's impossible. Yeah, thank you, Vincent. I appreciate that. Yeah, Vincent, glucose is very deceptive. And for that matter, so is insulin. Remember, it's on a cycle just like everything else insulin is. So that's why I want you to all be consistent with the time of day and the amount of hours fasted and the exercise routine. Make sure everything is exactly the same, consistent. Blood draw after blood draw after blood draw, okay? Yes, glucose is very deceptive. It can look normal, and you could be insulin resistant for years, meaning you got your pancreas is pumping out from the beta cells very, very high amounts of insulin in order to keep your blood sugars down. Because doctors are glucose-centric, they're only looking at glucose. They are not looking at insulin. Insulin paints a story much, much earlier than your blood sugars will. Your blood sugars could look normal. You could be diabetic for 10 years. I say underlying diabetes, okay? The A1C is not going to indicate that. I don't think that doctors even look at A1Cs. They let A1Cs go of 7. You're diabetic, okay? You're out of control. Yeah, Pisces, I agree. It's hard to lose weight if you're drinking alcohol. I agree. I agree with that. Prime Color says, any advice about a weak upper esophageal sphincter that practically never closes? Find out what is the cause of the relaxation. Could it be peppermint or spearmint or spices or alcohol or smoking? It's got to be something that has lowered your esophageal sphincter tone. Statin is a moneymaker, says Vincent. It was a moneymaker. It was a moneymaker, but now it's generic. So it's not so much a moneymaker. But they've gotten you guys so scared that if they tell you to take a PCSK9 and the statin, because we need to get your LDL down, we just shifted the goalposts, Vincent. And instead of the statin making them money, they had something else in the pipeline. Oh, 14 pounds is 1 stone. Thank you. So that person gained 28 pounds. Thank you, Pintalk. I appreciate that. Yeah, I agree, Vincent. We got to treat the underlying cause of the problem instead of just treating the symptom. Michael is watching from Rocky Point, North Carolina, I'm guessing. Thank you for being here. Okay. Sarah says, is it bad if my diet consists of 90% protein slop? Well, I think you've already know it's a diet because you're calling it slop. And it's 90% slop, which is protein bars, protein chips, etc. You already know, Sarah. I don't even need to answer your question. You already know. Happy to see you too, Eldon. Thanks for being here. No, Lisa, I can't answer your question about lichen sclerosis. I'm not familiar enough with it to give you any type of advice. Arizona Nana asks, what are your thoughts on a Mediterranean diet? One, I would want to know the definition of what you consider a Mediterranean diet, and then I can go from there. Marshur says, hopefully I didn't slaughter that name. I apologize. Are you like the only doctor in the U.S. who knows everything and all other doctors are stupid? Absolutely not. I don't know everything. I read a lot. I study a lot. I want to soak up everything because there are so many questions. And I found out that I am not living in a silo. I don't live in a silo. There's got to be something else going on. I don't believe in the specialist myth where you need to go to a specialist for everything. I think you can be your own specialist. I think you can educate yourself, and I think you could help your primary care doctor get out of the matrix. But if not, and they want to live in the matrix, that does not mean you have to. So you find somebody that doesn't want to live in the matrix with you and can work with you. And yeah, maybe finding that doctor could be hard, but again, the best doctor is the one looking back in the mirror at you, unless of course you need a bone fixed, you break a bone, cut off a finger, whatever, an acute emergency situation like we talked about earlier. Again, are they stupid? I don't know what your definition of stupid is. I think they have a condition of ignorosis. I made up that word. Osis means condition of ignorance. They either don't take the time to learn or they really enjoy being indoctrinated. They actually believe their own lies. And I used to be in that boat. I used to believe that, well, the silo was the best place to be. It protected me. And now I want to know the truth. I seek truth. And if you think you know it all and you're done and everything is written in stone and that's just plain science, then you're wrong because science is changing. I want to know truth. I want to seek truth. I don't want to live in somebody else's dream and somebody else's silo and say LDL is the cause of everything and call it good. If we called it good, then we would not have anybody with heart attacks. Prasha asks, any advice on how to manage and get rid of stage 1 lipedema? Low carb diet, low carb restriction, carbohydrate restriction. Arizona Nana says, my doctor told me to go on a Mediterranean diet, fresh veggies, fresh uncooked veggies. Did he know about, or she, did they know about oxalates, phytates, tannins, saponins? No processed foods, I agree. Okay? Lean meats, why lean? Why lean? That means we don't need saturated fat for our cell membranes? We do. Every cell is made of cholesterol. So if we eat fat-free, then we have no cholesterol for our cell membranes, no cholesterol for our myelin sheath, for our brain. Eat berries. What kind of berries? Are they aware of fructose? Are they aware that you might have fatty liver disease? Did they do a liver ultrasound? Is your ALT and AST above 15? Is your GGT above 20? Is your ELK phos above 100? Before they told you to eat berries, did they ask those things? The nuts. Nuts are good for you. Are they? Are they full of mold? Are they full of lectins? What do those do to you? We should probably look into it. Very little carbs. Everything you just mentioned is carbs. The berries are carbs. The nuts are carbs. The fresh veggies are carbs. So saying that's very little carbs is not saying that's not true, because what you just mentioned is all carbs. If you're afraid of eating meat, your whole diet is going to be full of berries and nuts and fresh vegetables, and that's all carbs. That's all inflammatory. Our body cannot break them down. We do not have a cellulase enzyme in our body. We poop them out. You're feeding bugs in your bowels. You're not eating them. You're not gaining anything. You're feeding rent-free bugs in your gut. And then the rest that they can't eat, that's called waste. And it goes into the stool, hopefully. So what is it about that particular diet that is good for your heart? How is it different than carnivore? as he said, meat only once a week. It's also confusing. So he is still living in prehistoric times when what you eat full of cholesterol is actually the cause of your heart disease. So you're going to eat the meat and it's going to go down in your mouth, down your esophagus, into your stomach, and then into your intestines, and then magically it's going to go to your heart and cause a heart attack. I just don't know. I mean, that was debunked around 2016, about maybe even before that what we eat does not cause coronary artery disease. Then we shifted gears to the liver producing all the fat and cholesterol. So we shouldn't eat, then we got medicines. That's it. So if it's not what you eat, it's got to be your liver that's damaged. It's an overproducer. Is it? Did you check? Are you an overproducer or are you a hyperabsorber? Did anyone check? Do you have LDL receptors on your liver, or is that the problem? What about the PCSK9? Did anybody check? You guys, I know it sounds confusing, but over time you will get this. Over time you will understand this whole process. It just is a learning journey. Your doctor stopped years ago learning. They ramble off the keywords: Mediterranean diet, statin, LDL, APO, now it's ApoB, don't eat cholesterol, don't eat meat. It's a lie. You don't have to be confused about anything because it's a lie. Now, if you are that person that I spoke about earlier and you are a carnivore and your LDL is still sky high, your body cannot tolerate heavy amounts of saturated fat. You could choose the leaner sources of meat. You can still eat red ruminant meat. It's still good for you. It's heme iron. It's got all the nutrients you need. You can still eat eggs. You might want to incorporate some more fish, some more chicken, because your body, he didn't check, but your body may not be able to tolerate that much saturated fat. So you have to increase monounsaturated fat. Does that mean going off carnivore? No. You increase monounsaturated carnivore sources like emu fat, duck fat, lard, higher in monounsaturated fat and lower in saturated fat. But again, using a broad brushstroke and telling Nana to just do these things without a proper diagnosis, but that would take too much time. And that might take their money out of their pool that they could use later. And 3, they might have a condition of ignorosis and not even know what all those tests are. Tia says, the Bible reflects eating foods like carbs and meat. It seems balanced. How then do they get eating meat primarily? I don't know, Tia. Where in the Bible does it reflect eating foods like carbs and meat? Does it actually say those things? Or is that our interpretation? So if the Bible says bread, does that mean there's actually bread? And is that bread the same as the bread today, which is fake? Or is bread referring to Jesus? That the bread of life is Jesus, not the actual bread that we think of today. Now, did people, hunter and gatherers, have bread? Doubtful. Did they have berries? Maybe. Did they have wild animals that they hunted down, they ran after for short sprints, hunted them down, and ate every piece of that animal? Didn't waste a thing? They ate from nose to tail, including the blood? I believe that. Okay? Tia says, can you please provide some feedback on having high elk phos for years? Is it possibly a liver issue? Well, if your elk phos is over 100 and it's been over 100 for years, your bile ducts have sludge in them. They are leaking out enzymes, inflammatory markers. They can't handle the irritation in your common bile ducts. That's called cholestasis. Your liver might be pumping it out, but it's pumping out sludge through ducts that can't handle it. So you have a bile duct problem. You might have a liver problem as well. But ELK Phos over 100 tells me that you have a bile duct problem. You have sludge in your common bile duct. And that is not good. That's called cholestasis. Precious says, is high fiber good for the heart? I'm not sure. I've never heard where high fiber actually makes the heart pump faster or better. I've heard ketones can increase stroke volume and cardiac output. So ketones I would rely on. Fiber? No, not so much. How can we get higher fiber when you're low carb? Well, you can still eat just complete vegetables with fiber and still be lower carb. You're very welcome. Pisces says, something I've learned by being an educator is that people don't always understand what a carbohydrate is, what are all the names for sugar are, etc. I agree. We probably, even myself, assume that you know the difference between a carbohydrate, a protein, and a fat. Maybe I shouldn't assume, but for the most part, anything that does not come from an animal is a plant. Anything that does not come from an animal is a plant. All plants are carbohydrates. Do animals have carbohydrates? Yes, their milk, their cheese that we eat, they do have carbohydrates. Their natural sugars are in them and we drink them, lactose. Okay? So a carbohydrate is needed when we are a baby. We need to drink our mother's milk because that's how we grow, and we get her fat and cholesterol. We get everything we need from the bosom. We do not need to consume these things because we're done growing after about the age of, 20? We're done growing. Maybe even before that, 17, 18. But we are the only species who drinks another species' milk, for that matter, after the age of 5. Can we break down lactose? Likely not. Our gut stops producing lactase enzyme after the age of 5 or 6 or somewhere in there. So we don't even have lactase enzyme. So we tolerate eating dairy and drinking milk. We just tolerate it. Why do you have an upset stomach? You know what? It's normal. That's normal for me. I just have a bad gut. Okay. All right. Tia says, I read that eggs have arginine and that is not good for Epstein-Barr. I'd have to look it up. Sorry. Okay. Okay. I'm trying to pick out you guys' questions over here, you guys on YouTube. If you can put a question mark in front of it, it's much easier for me to pick out. Okay. Hi, Maria. Thank you for being here. Raf says, are animal saturated fats as bad as they say? What is the difference between an animal saturated fat and a plant saturated fat? Like coconut, for instance, has 60, 70% saturated fat. Why is it okay to eat a coconut, but it's not okay to eat a steak? What makes a fatty acid is the amount of carbon chains, the length of the carbon chains. So I'm not sure why a doctor would say, I don't want you to eat any meat, but you can have coconut. Okay, well, eat coconut oil. Well, that has more saturated fat than a ribeye steak. So what is it, doctor? You just don't like animals, or you actually believe it's different? And if so, tell me the difference. Prime Colors says, what are the best exercises in general? Anything that works big muscle groups. Squats, deadlifts, rows, chest press, those are going to be the best exercises to keep you with muscle. You want to work the big muscle groups. So you want to work glutes, hamstrings, and quadriceps. So doing squats, lifting your body through space, those are the best exercises. And they also increase BDNF. That is brain-derived neurotropic factor. So it makes your brain stronger. Wild Dog says, I say jumping jacks on trampoline. They also get lymphatic system going. Absolutely. Yep. We want to get lymphatics going, especially if you have lipedema. I think that's what you're referring to. But yeah, low carb and lymphatics and lymphatic drainage, right? Okay. I agree, Wild Dog. The word is bread, the bread of life. John 1:1, right? In the beginning was the word. Okay. Okay. Griff, I don't understand your question. Sorry. T-Rose says, I drink lactoid milk. You mean lacto-free milk? Lactoid means, oid means a lookalike. So it's a lookalike of lactose. Does that mean you're drinking soy, a plant? Prasha says, is grass-fed butter an exception when talking about dairy being not good for humans? I didn't say dairy was not good for humans, okay? Is grass-fed butter better than not grass-fed butter? Absolutely. Grass-fed butter is going to be higher in omega-3s. Grass-fed butter comes from a grass-fed cow. We want grass-fed animals. If we're going to eat the animals, we would rather have pasture-raised or grass-fed. Pisces says, could you do more on exercise routines for women, especially weight training? Yeah, Pisces, on our next consult together, we can talk about that. Or if you want me to write out a program for you, or if you want some ideas. But for the most part, we need muscle. Muscle is the organ of longevity. We want to focus on the largest muscle groups in our body. The largest muscle in our body is the gluteus maximus. The largest muscle group in our body is the quadriceps. We want to work quads, hams, glutes, lats, our back. Those are the largest muscle groups in our body. So for your back, you have a width of your back. So you do anything in the up and down. So lat pull downs, that will work your width of your back. That's your lat spread. Then you have a thickness of your back, the front to back. You want to do rows to build that back. For your glutes, you can do bent over rows and Romanian deadlifts or regular deadlifts, sumo style or classic style deadlifts. You can do squats. You can do leg press. You can do leg extensions, hamstring curls, bent over rows and deadlifts for your hamstrings. Working those muscle groups in some sort of combination would be in your best interest, okay? Okay. Mary says, what can I do to help lymphatic drainage? I mean, somebody mentioned trampoline, doing the trampoline. There's the dry scraping. There's certain massages that you can do to increase lymphatic drainage. But I would ask, what is causing your decreased lymphatic drainage? Doctor, what are the foods to make bones strong after 60 years old? To make bones strong your whole life, you need protein. People think that calcium makes their bones strong. It is a component, but mostly it is protein. If you do not eat protein and you fast too much and you don't get enough nutrition from protein and fats, your bones will be weak. A DEXA scan does not indicate strength of your bone. A DEXA scan tells you the density of your bone, not the strength. You could have high density and weak bones and they fracture. Protein is the answer. Pisces says, going to schedule a consult to develop a compressive weight training plan. Comprehensive, thank you. All right, I'll watch for it. Vitamin D or protein, which one do we need more? Both. Both. But if you don't have protein, whoa. Prime colors, what is the best source of protein? Animals. Animals. They are complete proteins. Animal proteins. We are an animal. We eat animal protein. We cannot assimilate plant proteins as well as we can assimilate animal proteins. You have to finagle many different types of plants in order to make a complete essential protein. But if you want to try that hard, I just go simply eat the animal. Does the diet of the animal matter as much as they say it does? It matters. But if you have a choice between grain-fed animals and no animals, choose the grain-fed animals. With ruminant animals, that means they have a multi-chambered stomach. Multi-chambered. They're polygastric. Their meat, even if they ate grains, is going to be good. Is it better to eat grass-fed? Yes. But monogastric animals, everything they eat, we will likely eat as well. Those animals are pig and chicken and turkey. They're monogastric. Like we are monogastric animals. But ruminant meats are polygastric. Bison, buffalo, sheep, lamb, deer, cow, they're polygastric animals. And so I'm going to eat them whether or not they're grass-fed or grain-fed. They're better than not eating them at all. Or eating chicken. Now, if the chicken was pasture-raised and did not eat grain, then that chicken is good to eat. Okay? Why do rheumatologists say not to eat red meat to avoid gout flare-up? Because they believe that the only thing that causes uric acid is meat. And that's not true. Because a person who eats fruit can have a higher uric acid level than a meat eater. If the meat eater is only eating muscle meat and getting only methionine, they will be low in glycine, another amino acid that we absolutely need in order to survive. So if all of our glycine, we make 3 grams a day, is being used up to neutralize all of the methionine, then there's no glycine for the kidneys to use to excrete uric acid. So I would ask, is it the meat or is it something else? But just to say, don't eat meat because it causes a gout flare-up, not very many people who eat carnivore have gout flare-ups. And if they do, it tells me that they are just eating muscle meat and they are not getting enough glycine in their diet. Okay? You get glycine from eating all of the other components like the tendons and the cartilage. That's where you get glycine. So you got to eat head to or nose to tail, so to speak. There's so many things that are involved, and your doctor just simply says, don't eat meat. As if you don't need meat. You don't need the heme iron. Well, you can live on non-heme iron. No, you can't. No, you can't. So, nuances. Again, we hear half-truths, not the whole truth. We're hearing half-truths. While trying to diversify from saturated fat, I'm choosing chicken, turkey, fish, but it's hard to find purely pasteurized chicken. Is fish a better trade-off? At this point, Pisces, I know it can just overwhelm you with so much of this. In your case, trying to get that LDL down and then rechecking, we want to check an omega RBC omega-3 index in the future. We want to see if you are actually getting too many omega-6s, okay? Maybe you're not. Maybe that chicken or that turkey is fine. But if we get an omega-3 RBC, red blood cell omega-3, if we get a red blood cell omega-3 index, we can tell a lot about how you are processing omega-3s and omega-6s, okay? If your body is still inflamed and very inflammatory, that index will be less than 4. And that puts your risk of having cardiovascular disease much higher. So if you want to eat the chicken and the turkey right now and you want to be consistent, and then the next labs, we check an RBC omega-3 index, write it down please so I won't forget, then that might give us a little indication of whether or not you're taking in too many omega-6s through that chicken and turkey. Is fish better? I would say smaller fish like sardines would be a great choice. They're smaller. They're not going to soak up as much of the heavy metals and all of that. So trade-off, maybe not. I might get 97% lean meat if I still want to eat red meat on a regular basis. I would just get 97. It's very, very lean. Or get bison or buffalo. Okay? Pisces said, omega-6 is not high now. It's all perfect. So we'll see what happens with the added chicken. Perfect. I think that's a perfect plan. You'll know then. Wada Wada says, but after 60, we can't eat that much animal because of low digestion. Wada Wada, what is it magical about 60 years old that tells you you can't digest animals? Is our life just end at the age of 60 and we can no longer eat animals? I'm not sure where you got that. Prime Color says, that's what I was thinking. Even if my beef is soy fed, it's better than no meat whatsoever. Well, in my book, I would agree with that. Okay. Matthew says, there are complex chemicals the body requires that can't be obtained through just meat. What complex chemicals are you referring to? Eggs are 100% bioavailable. Eggs are, the yolk is magic. That's what raises a baby chickie outside of its mother's body. It lives on its own yolk. So it would be in our best interest to eat the yolks. What is your opinion of soy milk? I think you already know the answer. It is not milk. It is soy that's been mashed down into a white liquid. If it's white at all, I'm not sure. I don't know how it got white. So it is not milk. Milk is milk. Milk comes from a cow. So what do I think of putting a plant, soy, in my body? I don't think much of it. I would never do that. There's no nutritional value to that. For me. Might be for you. You might love the taste and be delighted to have a glass of soy liquid. Soy is also estrogenic. And you might say, well, great, I'm going to do that because I'm in menopause. Okay, that would be fine. Pasha says, why would someone have a histamine response to eggs? It's probably the whites. There are proteins that, if they are not fully cooked, can react in our body. Wada, what is your daily diet? I eat meat and eggs and butter and 10 macadamia nuts and half a cup of cottage cheese, cup of coffee, 2 ounces of cream, collagen bone broth. That's it. I think that's it. That's what I consume in a day. 2 meals usually, 2 meals a day. I had chicken last night. I rarely have chicken. Oh, I forgot sardines. Today, I'm going to have sardines and eggs when I get done with this live stream. Wada says, so what should we eat? It's up to you. If your body can tolerate whatever it's eating and you don't have disease, then go for it. I mean, do people survive on a plant-based diet? Of course. I mean, some people can eat processed foods, seed oils, and never have a problem. They might have some joint aches and pains. They might have had a hip replacement, but they didn't chalk that up to their diet, of course. They could have a dad bod and they don't chalk that up to their diet either. But we seem to think that having a dad bod is cool and hip, and I don't know about that. What to eat if you have fatty liver? The only thing that can cause fatty liver is insulin. Insulin is anabolic. It builds fat. What raises insulin? Sugar. What raises sugar? Carbohydrates. Alcohol and fructose are the highest producers of fatty liver. Then comes glucose. So if it is in your best interest, if you have fatty liver, to abstain from fructose, that means fruit, abstain from alcohol, and abstain from high intakes of glucose, which is all carbohydrates. That will get rid of your fatty liver. What happens if you have liver damage? What kind of liver damage? Carnivore is harder then. Why is that harder? Why is carnivore harder? Seems that if you have liver damage, it was caused by carbohydrates, and I would want to lower my carbohydrates. If I had kidney failure, I want to lower my glucose so it doesn't have to filter glucose. If I have a liver, I don't want to keep feeding it fructose and glucose because it's going to build up more and more triglycerides. You're overworking your liver. You're making your liver damage even faster. Liver damage starts out with fatty liver, then inflammation, then fibrosis, then failure. How did we get the original fatty liver? Like wada. Then what caused the inflammation? Then what caused fibrosis, which is scarring? That is over and over inflammation that never goes away. Then your liver becomes hard like a brick, fibrotic. And then we measure the fibrosis. And we tell you how far gone you are. We get a FIB4 and tell you, oh my gosh, your liver is failing. Well, you don't have cirrhosis yet. Did anybody check your liver function tests? What is your AST, ALT? Did they catch it early? Did they catch it late? Did they let a 20 or a 30 ALT, AST go for years and years and years? Did they ever get a GGT? Likely not. Did they look at your ELK phos? Did they see that you had sludge and backup cholestasis? It was an indicator many years ago, ELK phos over 100. Oh God, I look back and my ELK phos was over 100 for 10 years. 10 years you had liver sludge. Backing up. Nobody looked. Well, my AST and ALT were normal. Who says they were normal? Well, they were in the reference range. Well, then you're just comparing yourself with a bunch of sick people. A normal AST to ALT ratio is 1, okay? And they should be in the 10 to 15 range. GGT should be less than 20. L says, what do I think of ashwagandha? For what? Is it ashwagandha because you have sympathetic overdrive and you're constantly stressed? Instead of taking a medication, even if it's a natural supplement, wouldn't you remove whatever is increasing your sympathetic overdrive? And then wouldn't you work on increasing parasympathetic tone, vagal tone exercises? So I don't know the stability and the certification of ashwagandha that's put in a capsule, but I would first want to know, what is the reason I'm taking ashwagandha? So am I taking it because I'm anxious and depressed? I would say, what are you anxious and stressed about or depressed about? What caused your anxious, depressed? Are you sitting under a bunch of blue lights? You work 12 hours a day. You never get in the sun. You never take a walk. You don't have very good friends. You never stand barefoot on the ground. You eat a crapola diet. You don't exercise. Am I going to take ashwagandha and fix all of those things? I doubt it. I doubt there is enough ashwagandha that can fix even your anxiousness about finances and a stressful job. I feel for you. I have many a time been in a stressful job and worried about my finances. I feel for you. And God opened doors. God opened this door to talk to you. Is it lucrative? Am I going to be a millionaire because I'm talking to 3,000 people? We made $10 today. $10. 57 people gave $10. My job is not very lucrative. Am I begging for you guys to give me money? No. Do people consult with me as a client and that is helping with my income? Absolutely. But it amazes me how we take for granted everybody giving free information, and you say, you know what? They're a doctor. They can do it. They're rich. They're rolling naked on their couch in dollar bills. My financial advisor gave me that little tidbit, that analogy, and I've never forgotten it. I think he told me that analogy 20 years ago. And I think we assume that things are fine and dandy because Al could work for some Fortune 500 company and still be not making enough money to support his family or her family, I don't know, and be stressed at a job where you're being treated like crapola. Everybody's got their own package, okay? And I feel for you because I've been there. We all have been there. I think everybody listening has been there. And then we go out and we try to do things differently. I'm trying to do this differently. I'm not going to be a doctor in an office seeing 40 patients a day again. I've chosen not to do that again. I've also chosen not to see 10 or 15 patients. Why? Because I think I can help 3,000 people in a day by you listening to me. I might not be telling the truth, but I might get you to go look something up. And that's what I want you to do. I am trying to stimulate your brain. We have been in standby. We let everybody make decisions for us. We never use our brain. We never think things through. We never connect our own dots. And that is sad because one day somebody's going to steal your brain. They already have. They've addicted you to crapola foods. They've stolen your brain. You can't think for longer than 3 hours until you get your dose. Pavlov's dogs, your mouth starts watering and you eat your piece of chocolate or eat your bread. There is no nutritional value in any of those things. Yet we continue to be controlled by big food and big pharma. And doctors are just pawns of the big system. And so is every other job for that matter. So, like I say, you got to jump out of the matrix. It's not possible to live in a bubble. We have to live and do the best we can, waiting for Jesus to come. Or waiting for us to go to Jesus, whichever comes first. Okay. Dr. J, do you ever get sugar cravings? And if so, what can you do? Put a piece of butter and some salt in your mouth, and it usually goes away within about 15 minutes. Sardines for breakfast. Oops, I just lost that. I touched the screen. Sorry, so sorry about that. How do you treat liver sludge? Get rid of the insulin-provoking carbohydrates, and temporarily you could use something like Tudca, Tudca, or Tudca, however you want to say it. That will help thin the secretions. That will help thin the secretions of the sludge, make it thinner. Pisces says she eats sardines for breakfast. It's the best and it keeps her satisfied a long time. Yep, can of sardines and a few eggs. Call her good. I love that. Okay. Guy Lazarus says, what is safer to use than low-dose baby aspirin regimen? Why are you on a low-dose baby aspirin? What is your diagnosis? Are there alternatives to fibrin breakdown? Yes. Are we just thinning out and making your platelets less sticky? Is that your problem? Or do we have a fibrinogen problem? And are there fibrin blockers? Yes. Nattokinase, lumbrokinase, serrapeptase, all of those can help to decrease fibrin. Fibrin is the blood clot former. The trot. So where do we start to remedy the fatty liver? Fibrosis screen of 3 to break the carb cravings. They just started me on insulin. So if you got put on insulin, they just made your fatty liver worse. Your fatty liver is from high insulin. And now they're giving you more insulin. They are actually poisoning your liver. Why do you need insulin? Are you maxed out on all of your orals? Your oral blood sugar lowering medicines? You're maxed out and the only thing left is insulin to lower your blood sugar? Or are you that desperate that you will lock yourself in a room and stop eating the carbohydrates? And you might go into withdrawal. And this is not medical advice. But at some point, you need to decide to withstand 2 weeks of carb cravings to allow your blood sugar to come down, your insulin to come down, and start reversing your fatty liver. Because by giving you insulin, they are worse at your fibrotic score, just for the fact, your fibrosis score, your FIB4 score, it's going to be higher. It's going to be higher. Okay. 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 Grateful Warrior Mom, sounds like you got a lot of stuff. I understand why you would not trust doctors. I get it. And I can't tell you that I trust them any more than you. If I need a new hip or I need a new shoulder, I'm going to trust the carpenter to perform the carpentry on those areas. But if I have to understand the normal physiologic and biologic processes that go on in my body, I got to do that on my own. Did we learn that in medical school and I have some sort of magical superpower? I do not. I have to read and study and learn and listen just like you do. I put my pants on like you do. I put my shirt on like you do. I brush my teeth like you do. I go to the bathroom like you do. There is nothing magical superpower about me going to medical school and being smarter than you. Not even close. Because the stuff I'm teaching you today was never taught to me. We're in a silo and we had blinders on, and that is how we learned. If I only want to teach you that in order to be grass, it has to be green and any other shade is not it, then you're going to think that grass is only this certain shade of green and it can be nothing else. But I convinced you and I gave you just enough data that you will believe me for the rest of your life. That's called cognitive dissonance. Cognitive dissonance is when somebody challenges you and says, well, you know what? There's actually different shades of grass, of green grass, and some grass is brown if it's dormant. And you say, oh my gosh. So you have to dump out of your little glass some of the experiences so the new experiences can fit in there. I personally had to dump out the whole glass, I think, and put all new information in there. And that is overwhelming. It hurts my little brain that I have to undo everything that I was taught. Okay? Undo it. And maybe by undoing it, I might find that there's a little bit of truth in a lot of lie. Okay? But maybe there's a little bit of truth about LDL being bad for our body. But what kind of LDL? And why did we get that LDL? And why didn't we just stop whatever was causing the LDL that was causing the problem? Why do we have to take a medicine? You're very welcome, Tia. Guy says stents were placed 7 years ago. So anytime that we have stents, it increases our risk of having another event. Anytime we have a bypass, we're at higher risk of having another event. The tips or the ends of those stents are areas that can get more plaque. So Trot says metformin is maxed out at 2,000 milligrams per day for 30 years. What about Jardiance? What about a GLP? Are you just maxed out on metformin and then they go to insulin? They are poisoning you. Unfortunately, Trot, you are being poisoned with insulin. You have type 2 diabetes, I'm assuming. Type 2 diabetes is a condition of hyperinsulinemia. You have too much insulin. You don't give more insulin to a person who has too much insulin. You are poisoning them. You take away the things that raise the insulin in the body, carbohydrates, severe restriction to allow insulin to go down. But yeah, insulin is worsening your fatty liver, causing cirrhosis. I thought insulin was, okay. You thought insulin was bad, but your endo said it would help your fatty liver? Wow. I don't think I can get on board with that, Trot. I'm sorry. Can I recommend a good brand of sardines to eat? Oh, shoot. I think it's called Wild Planet is the one I use. Wild Planet. They're whole sardines. They're all whole. I mean, they're not like mushed up like tuna fish. Sometimes you'll get sardines that kind of are all mushed up. These are These are good. Now, if anybody knows of any better sardines, please let me know, because I eat them at least 2-3 times a week. Tried GLPs, they made me very sick because you have cholestasis. Your liver is fed up and you can't tolerate that. You'll get nauseated. So you have PCOS and type 2. Your PCOS is caused by hyperinsulinemia. In your ovaries, you need to take testosterone and convert it to estrogen. All estrogens start out as testosterone. E1, E2, E3 all come from testosterone. All estrogens come from androgens. All estrogens come from androgens. In order to convert testosterone to estrogens, you need an enzyme called aromatase. In PCOS, you have hyperinsulinemia, and high insulin blocks aromatase enzyme converting testosterone to estrogen. So you get a buildup of testosterone, and you get male pattern side effects, hair growth, infertility, and because the insulin is so high, you end up getting diabetes. You have upper body fat, so from the belly up, so the pelvic region up, looks like a barrel because you have fatty liver disease. You have a barrel of fat. And then below the waist is usually skinny and muscular. It's not because you've got muscles that are strong, it's because you have fatty muscle. The insulin is causing fat cells to grow, and it's causing fat to be inside the muscle. It's called Wagyu beef. That's how Wagyu beef. You have intramuscular fat. That doesn't make them strong, it just makes them fatty. So PCOS treatment is to get rid of the carbohydrates, to lower the insulin, and allow your testosterone to aromatize into estrogen in the ovaries. Okay? Oh, thank you, and God bless you as well, Guy. I appreciate that. Tia says, my dad is on Jardiance for his heart. Doctor says it's cardioprotective. Okay. All right. Tudka, where to buy it? Amazon. Pre-diabetic with chronic liver disease. You're not pre-diabetic. You have underlying diabetes. If you have chronic liver disease, you have fatty liver, which is inflammatory, and then fibrotic, and then cirrhotic. I don't like sardines. I don't really prefer them either. I know that they are good for me. And sometimes on certain days, I just have to put them in my mouth, chop and chew them up and just swallow it. Because I know that I need the things that are in it. Essence says, what are your thoughts on bioidentical hormones for women in menopause, 55? Well, bioidentical hormones means they look like ours, but they are not ours. Hormones that are made in a lab are made from plants. Those are called phytosterols. They are not cholesterol. So when we eat saturated fat and cholesterol, we make pregnenolone. And then pregnenolone will tell the adrenal glands to make DHEA. And then DHEA will convert to androstenedione. And androstenedione will convert to testosterone. And then testosterone will aromatize into estrogens. That is normal animal body physiology and biology. When our ovaries shut down, we think that our body can't make estrogens anymore when your adrenal glands can. But they didn't tell us that. So they will give us bioidentical hormones, which are plant phytosterols, hoping that our body can assimilate a plant sterol in our cell membranes. It cannot. At first, you'll feel okay, and then you won't. If you are okay with putting plant sterols in your body in the place of an animal sterol, then I think that is your choice. That has to be informed consent. You have to know all of the things that you are signing up for. Could it be good? Yes. Could it be bad? Sure. It's just up to you. My thoughts are, I want to hopefully have my adrenal glands making DHEA and, getting to the end product estrogens without converting to DHT, because not all testosterone converts to estrogens, okay? Especially after menopause, we get conversion to DHT. And that can be a problem. So we got to keep our DHT conversion low, or else we are going to get thinning hair and male pattern everything because of DHT. So get your DHT levels, because honestly, you could take all of the phyto-bioidentical hormones and your testosterone can be converting even more to DHT because you're taking the phytoestrogens. Does that make sense? So at first, everything looks fine and dandy. And then as your body, yeah, please, Gym Rat, thank you. Please like and subscribe. Look, if you're not subscribed on YouTube or Instagram, hit the subscribe or the follow button, okay? And come back every Saturday at 9 a.m. Central for Saturday Live, and every Sunday at 10 a.m. Central. And we do this every week for the past, even on holidays, I've been doing this for the past almost 2 years, I think. Maybe it has been 2 years. 2023, was it June 25th, 2023. Guess what? We just passed 3 years. See how that happens? June 25th was the first day I did a reel. 2023. Wow. Yeah, Grateful Warrior thought that people who went to med school actually had a deep desire to learn and grow in their field. I think they do. I think initially that was the whole reason that we do what we do. But that doesn't mean that we had the ability to sense whether or not we were being indoctrinated. We might have started with a desire and then get indoctrinated, and it becomes a godlike principle that we know everything. You get kudos, you get pats on the backs if you're that smart and you know you can make a diagnosis, and then you know the medicine that fixed that diagnosis. It doesn't fix it, it treats it, might be just preserving you. It becomes your reality that you can make a diagnosis, and then you are smart enough to know what medication treats that diagnosis. That is the whole desire after a while of being in that doctor. Okay. At first, when you're thinking about it, you go, oh my gosh, I just want to help people and I want to prevent them from getting sick. That is the desire. Well, it was my desire. I can't speak for everybody. And then you get into it, and when you're being incentivized, even if it's a pat on the back or a kudo or, oh, you're so smart, or good job, I'll give you an A, all of that reinforces you make a diagnosis, you know the medication to treat it. And that's what we learn. So I'm sorry that you've, been led to believe that your doctors actually want to help you. They think they do, and they'll give you the diagnosis and give you the medication. And they also get reimbursed for doing that. And then they get their big house and their big car and their kids go to big schools and whatever. I'm not opposed to people spending money. I want them to spend money. If you got the money, go ahead. I don't even care if you go bankrupt, a doctor, that is. Get new fences at your house and hire new people. That's putting money into the workforce. If you start saving it up in a bank account, then you being a doctor doesn't help society very much. So you actually want those doctors to be spending their money and flaunting it, because that's what's paying the waitress her tips, and that's what's buying new cars. And you guys, you got to look at it the opposite way and say, hey, we want those doctors to be spending all of their hard-earned money, which, are they working hard? I think so overall. Okay. But my goodness, you guys, come on, give them a kudos. Like, keep spending, baby, keep spending. I need to sell my car to you. I need to I need you to build a new fence. I need to sell my lumber to you, and I got a fence builder. All of that, you guys, we got to look at it from a different direction and say, hey, they're putting money out into the society. Let them spend their stupid money. Okay. Thank you, Essence. Your skin looks beautiful. Must be my carnivore diet, my animal-based diet, and just taking care of it. Collagen, eating tendons and skin and all of that stuff. North Dakota says, so nice to hear that information for type 2 diabetics. Why give more insulin when a type 2 diabetic is excessive insulin to begin with? Wow, North Dakota, that is the $1 million question. Why give more insulin when type 2 diabetes is excessive insulin to begin with? $1 million question that 1 million physicians don't know the answer to. And if they do, they'll say, what do you want me to do? Do you want me to leave their blood sugars high and they get toxic and go into ketoacidosis? What is the doctor to do, North Dakota? I'm asking from a purely inquisitive. So if the doctor did not give trots the insulin and allowed the blood sugar to stay in the artery lining in the bloodstream, then the doctor is actually committing malpractice, right? I mean, they know that the person's going to have a blood sugar crisis and be in the hospital. So what else are they supposed to do, North Dakota? I mean, put yourself in the shoe of the doctor. Everything else is exhausted. Every other medication. The person doesn't want to stop eating carbs. They just love them so much. They'd eat their fingers off if they could have another piece of cake or ice cream or bread, pasta, cereal, whatever it is, oatmeal. What is the doctor to do? Let the person go into hyperglycemic crisis or give them insulin? I'm not defending the doctor because that doctor didn't take the time to tell trots that they have a nutrient overflow problem. They have too many carbohydrates coming in through their mouth. And they could fix the problem on their own. But the addiction is too much for them to handle, and they don't know what else to do. So they'll continue to eat the food and take the insulin and continue to get fattier, fatty liver, subcutaneous fat grows, fat everywhere. Fat in their muscle, fat in their heart, fatty pancreas, fatty tongue, fatty eyeballs, fatty everything, high insulin. So at this point, North Dakota, isn't it up to the person and not the doctor? The doctor is just basically treating the symptom that you caused. But if they do it unknowingly, like you're in the hospital, instead of giving you the metformin, they're just going to put you on a sliding scale insulin and then feed your face with a bunch of fatty foods full of seed oils and glucose-laden crap that they feed you in the hospital, and they'll just give you a sliding scale because they're so lazy. Instead of teaching you that those are the foods that caused you to get diabetes, they're just going to dose around your eating skills. But North Dakota, I agree with you. I'm just trying to give you the double-edged sword from a doctor's perspective, because they're going to blame you, North Dakota. They're not going to blame them. They're going to say, well, you know what? I can only do what I can do. I can't stop anything for that person. There's no other. I got to get the blood sugars down. Here's your insulin. But if they blatantly say, I'm going to give you insulin and it's going to help your fatty liver, well, yeah, it's going to help it grow, help it grow fattier. Great idea. That will make me more money. I'm going to put you on a whole bunch of medicines and make you come in, and I'm going to get scans, and I'm going to do the things that make me money. Oh my goodness. Yeah, Robo, Murpho, I'm so sorry. Working, buying or renting an apartment and trying to work overtime, it is very stressful. I don't know the answer. We've all been, there were times where I thought, I'm going to pick up cans on the side of the road. I was so desperate. And that's back in, medical school and residency. We're taking out loans for $200,000. I was working at a local YMCA cleaning up people's sweat after they were dripping. Do you think that they would clean their own sweat up? No. They dripped on those machines. It was all over the floor. And I got paid to clean up their stuff and fold towels. I did everything I could, okay, to pay back a $200,000 or $220,000 loan. We're all in predicaments. I wasn't just born with a spoon in my mouth. We were not well off, you guys. Not well off. I'm never going to complain. I had the best childhood ever, okay? I had everything I needed, minus Doritos. So I would just run to my neighbors. Yeah, I ate Doritos when I was a kid. I thought they were heaven. And now that I know that they were poisoning me, I would never eat a Dorito. But again, that's another story. Susan says, how do you get DHT low? Sometimes you have to take saw palmetto or pygeum or pumpkin. Things like that will block DHT. Okay, that one's a tough one in menopause. Yeah. Yep, Trots. Tia says, brilliant, understandable explanation of PCOS. Good. I'm glad to help. Does Jardiance give high insulin? No. Jardiance makes your kidneys spill sugar. Say your blood sugar is averaging 200. And if you take Jardiance, it will spill off 100 and leave you with 100. Now, can that be good for your kidneys over time? I can't imagine yet. All SGLT2s have kidney protection as one of their indications, as well as heart protection that I think Tia brought up as well. My whole thing is we don't need medications. We need to get rid of the things that is causing the need for Jardiance or an SGLT2. All right? Let's see. That might be the end of it. We've been talking for a long time. Mary Patch says in the UK, most doctors are just drug pushers. I would say the same thing about the United States. So you're in good company. How do you prevent ketosis? You mean ketoacidosis? Lower your blood sugar. Get rid of the, yeah, Allison, I might have made that one up. But fatty eyeballs. You've seen people have little cholesterol blotches. I call them fatty eyeballs. They got cholesterol right on their whites of their eyes. They're yellow fat balls. So fatty eyeballs. And people don't understand, your tongue grows bigger when you have insulin overload, okay? Hyperinsulinemia causes all of our organs to get bigger. And the tongue is one of those things. So you look in people's mouth and their tongue is gigantic and it's blocking off their airway. Then they call themselves sleep apnea, but they didn't get told that they have fatty tongue. And had you looked at their tongue and noticed it was fatty, you can't tell, it's just huge. And then you get an insulin and their insulin is like 40. And then you get AST and ALT and a GGT and an ALT-FOS, and you go, yeah, you got fatty liver. And then you get an ultrasound, yeah, you got fatty liver. Well, doc, how do I got fatty liver and fatty tongue? It's an organ. If you got fatty liver, you got fatty tongue and fatty eyeballs and fatty pancreas and fatty heart and fatty everything, okay? High insulin is growing. It grows fat cells fatter until they can't get any fatter. And then they spill their inners. They leak. They leak cytokines and inflammatory chemicals all over your body. And then you say, oh, I got sore knee. I'm just getting older. No, you're not. Well, you mean you are, but that's not the only cause of why your knee is hurting. You got inflammatory cytokines all over your body from leaking fat cells and bad crapola food. I think, Trot, there's a lot of people who has done low carb successfully. It's going to be hard, but you can do it. You might want to start out by taking in some exogenous ketones at the same time as you go low carb. This is just not medical advice, of course. None of this is medical advice. This is just me talking and giving a whole bunch of spewing information that I've read and listened to over the past 3 years. But yeah, if you're considerably thinking about going low carb, add in some exogenous ketones. It will smooth your transition so much more because you will use ketones for the energy, the ones you take in. Your body won't start making ketones until your insulin goes from wherever it's at now, like 30, 20, 40. It has to come down to 3 to 5 for you to start making ketones. Well, you could go 2 weeks before that happens. So adding in the ketones so your body has something to use as an energy source might help you. Okay? Okay. What causes puffiness under the eyes? Lots of things, but it could be diet. Delighted to be here says, thank you very much. I'm delighted that you're here as well. My doctor is recommending bread, pasta in the form of ancient grains. I've switched and don't experience sugar spikes. What are your thoughts? So you're wearing a continuous glucose monitor? And are you monitoring your AST, ALT, GGT? Are you monitoring your insulin level? Is it only blood sugar spikes that you're watching? Because a grain is a grain is a grain. It's a carbohydrate. It raises blood sugar. Whether you're seeing a spike or not, it could be a continuous 120 and you go, well, I didn't spike, so it must be okay. It's not. Because eventually, if you don't have enough muscle, you're not going to be able to use all of that grain. And do ancient grains increase our risk of celiac or leaky gut, irritable bowel? What is it about the ancient grain? The heirloom? Where did you buy the seeds? Where did the ancient grain come from? There's so many questions, Delighted. I just have so many questions. What are my thoughts on wearing a CGM? If you need that initially to see what foods is raising your blood sugars, then by all means wear it. All right, guys, we will call it quits today. And I will be back, Lord willing, I'll be back tomorrow. I forgot to tell you, I always introduce Tucker, but I got so, I don't know. I didn't forget him. I never do. In fact, I think way too much of him all the time. He's not going to think that, but he is constantly on my mind. I lost my soul dog in February of 2025, and I have not been the same since that loss. He was everything, and he helped me start this out. So this is my co-host, Tucker, and he's co-hosting from heaven. He's with Jesus right now, and I have his remains in this box. And he's on my desk nonstop. And so, yeah, I miss him, and he will be back, Lord willing, tomorrow at 10 a.m. Central, okay? So you guys have a blessed Saturday. Get some work done, relax, and enjoy some sun, stand barefoot on the ground, all of that stuff. Don't forget to like and subscribe. Email me at ironladydoc@aol.com if you want to sign up for a consultation. I'll send you some paperwork and we'll get that rolling. I do not take insurance, okay? I do not prescribe medications, but we talk things out one-on-one, you and I, an hour, 2 hours, whatever it takes, okay? So you guys have a blessed Saturday, and I will be back tomorrow, Sunday, 10 a.m. Central. You guys have a great one. See ya.